Hi, I'm Gemma, and today I'll be speaking about the effects of hypnosis as a complementary medicine. Hypnosis is a social interaction in which a subject responds to suggestions made by a hypnotist or a recording. The patient is induced into a trance or dreamlike state of deep relaxation and heightened awareness. This can alter their perception, voluntary action, and memory. Usually 4 to 12 sessions are needed to condition the patient, depending on the intensity of change required. Studies have shown that there are many benefits of hypnosis. For example, they can help patients gain control over behaviours they would like to change, such as addiction, and enhance performances, such as public speaking. They are also used alongside traditional pain management techniques to help alleviate symptoms, and also used for phobias and to relieve stress and anxiety. Despite dating back to the 18th century, the mode of action is still unknown. However, Figure 1 shows that brain imaging studies reveal higher activity in these 3 areas of the brain that are involved in learning and memory, emotion, and perception, all traits that are targeted during hypnosis. As seen in Table 1, the first systematic review investigated 5 randomized control trials that evaluated the effect of hypnosis on exam anxiety in students. Some studies investigated the effects of multiple sessions a week, whereas others did 1 weekly session over a 3-month period. Researchers calculated a standardized effect size to compare each outcome measures, as seen here, on 1 scale. They found a 3-point reduction across the 5 studies, suggesting hypnosis is effective in reducing exam anxiety, as seen in this column here. The results were statistically significant, and the effect size ranged from low to high, indicating practical significance. We'll now look at the quality of the first trial. The trial design increased the level of evidence, helping to increase the reliability of results. Whilst recruitment, allocation, and maintenance were done well, the sample was small, thus impacting the quality of evidence. The trials weren't double-blinded, adding potential for bias. The self-reporting method may have contributed to result expectancy bias, altering the significance of findings. However, by standardizing the results, the quality improved. There was also no heterogeneity, helping to increase validity. The results were continuous rather than binary, as the efficacy was high for patients who are receptive to hypnosis. Therefore, whilst it appears there is a correlation between hypnosis and exam anxiety, there are a few recommendations to increase the strength of evidence. Further analysis is recommended to compare the susceptibility of patients to hypnotic treatments. This will allow researchers to find an optimal number of hypnotic treatments to tailor an individual's anxiety. The second clinical trial was a systematic review of 85 primary crossover trials that aimed to quantify how effective hypnosis was in reducing pain. They found that hypnosis relieved pain symptoms for all pain outcomes, finding statistically significant results as seen in Table 2 here. Hypnotic suggestibility strongly influenced efficacy, with highly receptive patients responding best, and therefore having a 42% reduction in pain intensity. Hypnosis also increased pain tolerance and threshold, as seen here. The effect sizes were moderate to high, indicating practical significance. Clinically meaningful reductions in pain were obtained for both medium and highly receptive patients, helping to identify an optimal level of pain relief. We'll now review the quality of this study. Given the type of study, the level of evidence was strong, especially with the large sample. However, they weren't randomized control trials, so the potential bias may have been higher. Whilst the standardized results increase the quality of evidence, the sample had an average age of 24 years. This makes it difficult to apply results to the general population, impacting the strength of evidence. The self-reporting method, once again, may have contributed to result expectancy bias. Overall, the results found a clinically meaningful reduction in pain, suggesting hypnosis can be used as a safe alternative intervention. The p-values indicated high relevance of evidence. However, further studies need to be conducted to determine the effects of hypnosis on older individuals and chronic pain to increase the overall efficacy and strength of evidence. Given the studies investigated, hypnosis appears to be a safe complementary medicine. Whilst there are few known side effects apart from tiring the brain if overdone, it is recommended to consult with a therapist beforehand. It is not recommended for patients who have severe depression or psychosis, as it can sometimes release emotionally challenging memories. Those who are highly receptive to hypnosis will have the best outcomes, so it is recommended to keep an open mind when considering the treatment. Overall, hypnosis is a promising, cost-effective, and accessible complementary medicine to relieve stress and manage pain, which is why patients should consider hypnosis to complement traditional methods. Thank you.